And I can answer that question for you.
Yeah.
Can I just say something to Medicare, and have we touched on this?
No.
Medicare,
Yeah.
okay. We did, how much it just is spent, Medicare is the most efficient system
And it's single payer.
in a single
It
payer.
is single payer.
Yeah, on the Medicare exam.
Oh, okay, so. we're-
I'm very
And how
satisfied.
much money is spent administratively? Just an example for me, how much of a dollar is spent? How many people does it take for me to let a patient come into the hospital? All that administrative cost needs to go away in a health system.
I took my 5-year-old grandson to the A.I. DuPont Hospital in Delaware, and he broke his arm. We spent 45 minutes because my daughter-in-law thought that she had a referral for the doctor for 90 days, and the hospital said, no, you need a referral for the doctor in the hospital each time you come in there. So we stood there for 45 minutes, and I called my daughter-in-law called my son. It went on and on forever. Do you know what? I don't get that with Medicare, but I got that at that hospital with my grandson sitting there. So that was an insurance company disaster as far as I was concerned. Okay, so you were.
I was going to tell you, how do you save costs? Because of course, that is one of the main reasons why people are advocating for a single payer universal system. That's why we're advocating for it, because it will save costs, but not only will it save costs, but it'll offer more effective medicine. Now, let me tell you some of the issues that are involved. First of all, particularly when you're looking at elderly people, most of the money that's spent in healthcare is spent within the last year of their life. Okay? And it's spent for procedures that do not increase their life expectancy or quality of life. Okay? Now, it is ration care. I think our inspector is right. Yes, I do want ration care. Because what I want money spent on is I want money spent on the front side instead of spent on the back side where I'm not getting any return for it.
Exactly.
You see what I'm saying? So how you save money is you concentrate on those areas which are proven, by rigorous studies and and so forth. I'm not talking about anything that's made up. These are things that we actually have studies and we've done research on, and we can prove that they are effective, cost-based, programs that will result in savings because they have a health promotion or preventive care. That's right. That's right. See, one of the problems with our form of medicine now is, we have a curative medicine. We don't have a preventive-based medicine plan. Money is spent for treating acute illness. Care. That's right. Acute care, illness, and so forth. That's the model. And so my argument is that when you have, this is just one of the arguments, that when you have an effective plan now, see, that's another thing though, you've got to be a good plan, just because you say universal single payer healthcare doesn't mean it's good, but hopefully when we do, get people together and they put something together, it has these concepts in it, and that's how they'll save the money. You see my point?
Also, money is saved with underwriting and just the administrative fees associated with insurance companies in general. I was an insurance agent for a short stint as well. So you spend money going through the underwriting process, employing people to underwrite. When you have a universal health care system, you know that everyone is covered, regardless of what their health is.
As I said, I understand Medicare, and it's been quite effective for me and the friends of mine, and so and I believe that administratively it's proven that it's a cost-effective program, but I also understand that there may not be enough money, and I understand the argument about all the money that's spent on the last years of life, which is why I have written explicit instructions to my children. If they dare defy me, they will.
Right, yeah. I had that from my parents as well. Don't put me on no ventilator or machine, when my brain is already dead.
Yes, something.
I agree. Like yes. Now there is another issue too.
I just see this as a formidable task.
Oh, it is. It's not easy.
Everybody's focusing on the insurance carriers as being the greatest opposition against this, and of course they will, but I see it as the lawyers are not going to allow it.
Lawyers are not going to like it. They don't want toward reform.
It's not going to end. It's just, And the institutions that actually provide the direct service. they're not-
Pharmaceutical companies are not gonna like it.
Exactly.
How about the general public? It's interesting, having lived this lifetime and having seen public attitudes change toward issues on homosexuality, on abortion, and what, do you think we can convince the general public that this is really good for them?
Sure.
Yes.
And therefore they will.
That's why we're here.
Absolutely.
It's a formidable task.
Yes.
Yeah.
It's not easy. But you know something? And this is one of the things that I have. I think it's an all or nothing proposition. I don't think it's a compromise that you make. And I think that's why people have failed in the past. Because they try to take a middle of the road stance and try to address the people on the left and address the people on the right. It doesn't work. You have to have an effective plan that you think out and you have to go for it. When you start making all these compromises, what happens is that people on either side don't agree with it, and that's how you lose. You know, and that's one of the things. I really not really a major advocate for, you know, this plan that they have, but you know, people saying it's a first step toward, you know, a real single hair club, but you know, a public, you know, choice plan. That's
And
as
as I mentioned, Obama
Yeah.
wants to say before the August recess that he accomplished this thing.
That's right.
And
It's a
it's
first
to be
step,
very
but
symbolic.
it's not what we ultimately want to move toward.
Exactly.
You know? We want to move toward a system like they have in Canada or Great Britain or Italy or Japan. I mean, we need a universal system, everybody covered. You know?
A perfect illustration of what
And
you
it's-
said
right.
is what happened with what you saw on Inspector's office, that big old wall with.
Right, all those charts
Because
and arrows and boxes.
Hillary Clinton originally supported single
Right.
payer.
Right.
And it's so fascinating just to look at her changes
That's right.
because of the industry lawyers, tort
That's
reform,
right.
all this
That's
to
right.
the point where she's like, oh, no, we can compromise. She's the perfect example of
That's right.
the issue with trying to get compromised
That's
single
right.
payer.
That's right.
Eventually,
Zero.
compromised healthcare.
That's right.
Eventually it will be taken over by the healthcare industry. But the least I hope each of you could leave with tonight is, you know, your email, a contact that I can reach you at. I'll email everybody that wrote their email address the California Nurses Report so you could have evidence. They provide, in terms of empirical data, the most sound defense of how it could happen, how single payer could happen. And then I'll email you to ask if you'd like to join Progressive Democrats of America on the campaign for healthcare, not warfare. And basically that means just checking your email. You know, we have in this new age of technology, the opportunity for you to organize online, so you don't have to meet, you know, in a specific geographical place like every week. You can do it from your email, from a distant location. So in these emails that PDA sends, I talk on occasion with its National Director, Tim Carpenter. He has a direct, very close relationship with John Conyers, who sponsored the bill. And he tries to coax him to say, how can a layperson support single payer? And so what they do is they have these call-in days where you call in U.S. congresspersons telling them what is on that sheet. You know, all the things that are on that sheet, why single payer is the most appropriate. But I'd like to thank you so much for coming out. We'll probably